Welcome back to The Beat. We often hear from experts and political people about the coronavirus, but right now we turn to people who've lived it, specifically some young people who are increasingly contracting this virus. And like many these days, we're going to go ahead and do this via Zoom. I'm joined now by two people under 30 who got this virus. Jonah Stillman just turned 21 and got sick after traveling abroad for work. Raven McGregor is 27 and got sick, she believes, after going to the gym. And we'll get into whether there was enough social distancing. And we're also joined by Dr. Uche Blackstock, an emergency medical physician who does clinical work at a Brooklyn urgent care center. She also works with Advancing Health Equity, where she was a founder and partners with health organizations on equitable care. Thanks to all of you for doing this.
Thank you.
My pleasure.
Raven, how did you get the virus and were you surprised?
You know, I think that I got the virus when I was at the gym, and I was really surprised. I did not think that I was going to get sick. I kind of thought I was immune because I was young.
You felt immune because you were young, and does that mean you weren't necessarily always following the different guidelines?
I'd say so. I basically stayed at the gym until the governor mandated that it was closed. So I really wasn't doing what I needed to do in the beginning to not get sick. I first lost my taste and smell, and that wasn't even a symptom at the time, so I just thought I had a sinus infection. And then a few days later, I had the shortness of breath, I had the high temperature of 103. I decided to go to the emergency room and have a chest x-ray, and there was some fluid in my lungs. So it definitely was way worse than I even expected the virus to be, honestly.
How about you, Jonah?
Yeah, a lot of my symptoms were honestly pretty similar. I lost my smell and taste for over a month. That was one of my first symptoms, along with scratchy throat and a cough. But yeah, my symptoms, I had a high fever for about 10 days, was relatively sick, and I'm not someone that gets sick very often, but it was not a pleasant experience, and I don't wish it on anyone.
So a question to Jonah and then Raven. What do you say to other people who, like you, are in their 20s and think, I don't need to follow every rule, and if I get it, it won't be that bad? Jonah? I
would say you're wrong. I had it. It was not pleasant. I was definitely very sick. You're not immune. It's not impossible to get it. There's reasons and guidelines, these restrictions for a reason, and we have a responsibility to follow those to an extent.
So Raven, if someone in their 20s like you says, if I get it, it won't be that bad, you say?
I would say very much the same thing that Jonah said. We are not immune. We can get very sick, but we also have to think about others, right? So you could get over it, but you could pass it to someone else that could die. And to me, that matters more. So let's not be selfish. Let's wear our mask. Let's do, what we're supposed to do to make sure that we stay healthy and that we don't get others sick, and try to keep everyone else healthy too.
Dr. Blackstock?
Yeah, no, I think they are both bringing up such excellent points. I think initially in the pandemic, the data we were getting from China, we were getting this message that was mostly elderly people who were affected. But now we're seeing, especially with the reopenings, like over half the cases are people, under 40 years old. And so, when you have this many young people infected, they actually can infect other people, as Raven pointed out. And so that is really the danger. And these young people can actually get sick, as your other guests have shown, and they could even get hospitalized and end up in the intensive care unit. I actually have taken care of a number of these young people, and that was a scary part. I think this virus is incredibly unpredictable. I had young people, even in their 20s, with no medical problems, coming into my urgent care with low oxygen blood levels because of coronavirus.
Raven, what portion of your friends, roughly your peers, are following the rules?
I'd say maybe half and half. I have those friends that know that I was really sick from it, and now if they see me like walking somewhere or like going somewhere to eat, they're like, why are you going out? Like, this is still really bad. So I have those friends that take it very seriously, and then I have friends that just aren't taking it seriously at all. I think everyone's tired of being inside. So the weather's nice here in North Carolina. People are going out on boats and and having fun. So I have those friends that are like, I'm not going anywhere, and I have those friends that are like, you know what? We're going out. We're tired of being inside. So yeah.
And actually, if I can jump in there, what the biggest change that I saw actually is when I did have it, and I told my friends, similar to what Raven said, is once they knew I was sick, that kind of my close inner circle took it more seriously.
Now, doctor, I have an easy question for you. Raven said half and half. Is half and half good enough?
No, absolutely not good enough. No, we need everyone to take this seriously. And I think that what we've seen in other countries that have really contained the virus very well, everyone got on board and, with wearing masks and physical distancing. And that's what we're really going to need to do to see any progress over the next few months.
Dr. Blackstock, Jonas Stillman, and Raven McGregor, thanks to each of you for joining our special Zoom interview today.
Thank you.
Thank you.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.